Hello again, it's Jo Bragazzi from Jo Bragazzi Cosmetic and Medical Permanent Makeup. Just a little bit about me. I am a registered nurse, have been since 1996, which is a long time, and I've been doing permanent makeup and medical tattooing now for about 9 years, since 2011. I just at the moment want to talk to you a bit more about scar camouflage. So just to let you know the sort of scars that I would treat. So initially on the cosmetic side of the medical tattooing, the scars I would be looking to treat are anything that's white and flat and at least 12 months old. But it could be facelift scars, neck lift scars, any sort of cosmetic surgery, breast scars, scars around areolas, after breast surgery. It could be trauma scars, self-harm scars. It could be acne scarring, burns, skin grafts. So anybody who might have had skin cancer removed and had a skin graft. I work on men and women. Scalp scarring, where people have had sort of hair implants and it might not have worked, or it might have been from the donor site. Put little sort of hair, simulate the hair in there as well, but I'll always put the flesh colour on first, and then the hair over the top. Do a lot of work with transgender clients as well. So people transitioning from female to male or vice versa. So transitioning from female to male, they'll have the skin and the muscle donor site on their arms, which is then taken away and formed into a penis. So I would do some dry needling and micro needling on there to soften that sort of scar tissue, and then get some pigment in there to sort of camouflage it with the surrounding skin. With the newly formed penis, I would put on the highlights and the shadows as well, just to create sort of the illusion of veins to make it look more realistic. Obviously you've got the scar tissue around there where they've had the surgery, so I would camouflage that. Lots of genitalia work I do. So quite often males can have like cysts along the shaft of the penis, and those would be taken away, leaves sort of white marks. Sometimes after surgery down there they could ulcerate, so you've got sort of skin grafts, or where it's sort of granulated and you've got the newly formed skin but it's slightly indented and it's different colour. Men can be very conscious of these things just as much as women, so I do a lot of work with men. Being a nurse for so long, I have worked with all sorts of parts of the body, so nothing phases me. It really doesn't matter. I'm very, very conscious of covering everything apart from just the little area that I'm working on. So, privacy is a huge thing for me. What I would say is, if you are a male and you want to come see me, don't worry if you're scared. I mean, I have people on my couch trembling, poor things, particularly on that first session because they're so scared, but then generally second and third sessions, they're much more relaxed. They know what to expect. All I would say is, if I'm going to go through a treatment plan with you, and we are sort of working in those areas, then don't come for the wrong reasons. Okay, I have had a couple of men come for the wrong reasons. They don't stick with the aftercare and they have to keep coming back, and they don't stick with the aftercare and then they have to keep coming back, and I start wondering why. So I will discontinue that treatment plan. Okay, I've only had 2 in 9 years, but if you're not serious about properly having scar camouflage, don't come to me. I'm a nurse, I'm very professional, and I will treat you as long as you're serious to have the treatment done. Again, going back to both genders, lots of work on the face. You know, there might be vitiligo, there might be sort of scars from injury. It could be burn scars on the face. It could be some people use salicylic acid to try and get rid of things, and then they end up with an indented scar. So I do a lot of camouflage for that. Again, going back to transgender work, men transition into women. I do a lot of feminization work. So again, brows, eyeliner and lips, but also it's looking at the proper contouring. It's just not putting brows on, it's looking to how we can make your face look more feminine. And there might be areas where we actually have to look at eyeliner not as a makeup, but to change the shape of your eye, just to make it look a little bit more feminine, and the lips to make them more feminine rather than just pigment your own lip. Okay, because obviously the shape of men's lips are very different to women's. So I do a lot of, you know, all sorts of work. Again, vitiligo work could be anywhere on the body. What I would say is anywhere on the feet is quite difficult. Big patches are very difficult. They will take numerous sessions, and they can take quite a while, you know, to cover. Again, because I tend to do it in little dots, I might do some very soft sort of watercolour shading, but then I'll get the texture in with the dots. So I don't just do a block colour, I might use 5 or 6 different skin tones, and I'll be looking at the surrounding skin and the texture and the patterns, and I'll be recreating that inside the scar. So lots of different types of scars that I work with. Lots of different types of people. So, you know, if you're in one of these categories, don't be scared. It's very likely that I've already done it before. I get referrals from breast clinics, from consultants, mainly down in London for transgender work. So and skin clinics. So I've more than likely seen your case before. As I say, I've done this for 9 years. And at the beginning, lots and lots of trial and error, actually. Even though I was trained brilliantly, every single scar is different. Every single person's immunity is different, and skin is different. So we just have to be very cautious and play it by ear and stick with the treatment plan. Sometimes that treatment plan might be extended, and sometimes it might be a little bit shorter depending on how that scar takes the pigment. So we just have to wait and see. But if you're serious and you would like some scar camouflage, don't hesitate just to, you know, contact me. We can book a consultation, get in touch, and even if your scar isn't ready for me to do a treatment, then I can always, you know, refer you on to another practitioner that might be able to help you. The other thing is, I just want to say, is if you've got a keloid scar or a hypertrophic scar, so one of those quite ugly, shiny, raised, bulbous scars, I won't be able to work on you. So you would have to go to a skin clinic and a consultant, and they might need to, I don't know, inject with a steroid underneath the scar, but I'm not a specialist in that. So I would always refer you on to a skin specialist first. If you have got a history of keloiding or of hypertrophic scarring, then really long term my treatments aren't right for you. I would be too nervous to set off a scar, a hypertrophic or a keloid scar again on you, bearing in mind that's what your immune system has promoted before. So I'd be very nervous. I'm not happy to work on anybody that's had that in the past. So yeah, but if you don't have one of those and you feel that your scar is ready to come for treatment, then please get in touch with me. Okay, thank you very much. Take care. Bye bye.